During the course of this COVID-19 pandemic, together, we're flattening the curve in Howard County, slowing the spread, and preparing with Howard County General Hospital should there be an overwhelming surge in our cases. Our surge plan focuses on three major aspects of the operation: adding physical capacity to our hospital, tracking, streamlining, and purchasing vital equipment, and identifying and deploying staff to the hospital. We've been working tirelessly with our hospital, and I want to thank President Steve Snelgrove and his entire team for their commitment and strategic actions. We're also grateful that we have a hospital that is part of the Johns Hopkins system so that we can avail of these statewide assets. So how are we making sure that we are ready to handle a surge of positive COVID-19 or coronavirus patients? First, the hospital is repurposing different spaces within its four walls to make more room. Also, our Office of Emergency Management has been working with the State Hospital Surge Task Force and assisted in getting large tents to serve as additional medical capacity should all the adjustments within the hospital become maxed out. Lastly, we are also doing everything to identify additional locations and facilities. For example, many hotels are ready to assist. If any emergency staff contracts COVID-19 or coronavirus and cannot be home, or if there are homeless individuals who cannot safely isolate, hotels will serve as potential locations for these needs. In the worst case scenario, we are also ready to activate the gym at Howard Community College. These actions will allow our hospital to safely care for COVID-19 coronavirus patients and prevent further infection. The hospital has also identified oxygen or O2 machines, ventilators, and other critical needs. I want to end with a call to action. We have seen across our country and our world how people are making the difference in caring for our loved ones who get COVID-19 or coronavirus. And while we have identified Howard County retired physicians, nurses, medical technicians, and other public servants in healthcare, we still need as many talented residents in the health field to sign up for the Medical Reserve Corps or to contact our health department's warm line to assist. Because of our early actions, we have not seen a dramatic increase or surge yet. But should one outbreak change that, please know that our hospital is ready. I want to thank all our courageous emergency staff for your commitment and heroism. I know we will get through this together.
Hi, I'm Steve Snelgrove, President of Howard County General Hospital. COVID-19 has required an all-hands-on-deck planning response by communities across the nation. It includes many organizations, from first responders to health departments to hospitals, skilled nursing facilities, and home health, as we all prepared for this unprecedented pandemic. As the only hospital in Howard County General Hospital has a special responsibility to take care of this community and lead many of these planning efforts. And fortunately, as a member of Johns Hopkins Medicine, we have been able to enlist the resources of our entire health system to provide the planning and services that Howard County needs. We have all been concerned about the news from around the country and around the world about hospitals and healthcare facilities that have stretched to the point of breaking with COVID patients. We are doing our part to prepare for the peak number of patients who might arrive at our door. Over the past 8 weeks, We at Howard County General Hospital, in partnership with the Health Department and the Johns Hopkins Health System, have undertaken a comprehensive planning approach to make sure we maximize the number of beds, appropriate staff and equipment, particularly ventilators, to care for COVID-19 patients. We set up a hospital-based incident command center that coordinates 24/7 with both the counties and Johns Hopkins Health System's incident command centers. I want to share a little bit about what this process looks like and how we have kept elected officials and community leaders informed about our preparedness and the resources available to serve our community. The actual number of beds we can operate at Howard County General Hospital is set annually by state regulators and is based upon our prior year's occupancy. Currently, we have a license to operate 225 beds. The types of beds include medical surgical beds, intensive care, intermediate care, pediatrics, maternal care, neonatal intensive care, and psychiatry. Within that overall complement of 225 beds is our intensive care unit. It has 16 beds. Knowing that many COVID patients may require intensive care, we have executed a plan to more than double this number of ICU beds. We have stopped performing elective surgery to preserve PPE, personal protective equipment. This has enabled us to utilize our surgical suites and post-acute anesthesia recovery spaces for additional ICU capacity. So as of April 22nd, we now have 30 ICU beds available at the hospital. That number will grow to 40 by the end of the month for COVID patients. And we also have the necessary ventilators, physicians, and staff. And we also have ICU capacity for non-COVID patients. Not all COVID patients require intensive care. Many patients who have or may have the coronavirus can and are being managed appropriately on medical units which have negative pressure and HEPA filters to contain this highly infectious disease. Our facility engineers have been working 24/7 to convert more regular patient rooms to ones with negative air pressure and HEPA filters. Thanks to that work, right now, in addition to our ICU capacity, we have space for 110 COVID patients and have many more for non-COVID patients. And we have the ability and a plan to convert more space, including patient tents that have been erected at our front door. That will allow us to have nearly 50 more COVID beds. Everyone wants to know if that's enough and whether that means we meet the needs that projections illustrate. We are working to do our best to treat patients who arrive here, even if the worst case scenarios come true. To accomplish that, Howard County General Hospital does not operate alone. We are part of the Johns Hopkins Health System, which operates in 5 hospitals in Maryland and Washington, D.C. And the health system has internal plans to make sure every hospital has the resources it needs. Under a system-wide COVID plan, we can and do transfer some patients from Howard County General Hospital to Johns Hopkins Hospital, which has the technology and novel treatments for the sickest of the sick. This enables our patients to obtain optimal care from dedicated healthcare providers just a few miles away. Unfortunately, we do not know yet whether we are at, past, or near the peak of this crisis and exactly what our patient counts might look like. I can share with you that during the past several weeks, the volumes we have experienced here and within the Johns Hopkins Health System demonstrate we have planned well and have not exceeded our capacity to care for both COVID and non-COVID patients. Our staff cares for these patients with compassion and skilled professionalism. The work they are doing during these trying times is amazing. Because we have had to stop allowing visitors to enter the hospital, except under certain circumstances to protect both patients and staff, our providers have become real extensions of families and are providing loving care to our patients. And while the rate of COVID patients has been steady, we are ready for more if and when they arrive. Our planning also includes working outside the Johns Hopkins system. The Maryland Hospital Association and state officials are working together to make sure there is enough capacity to handle a statewide surge. That's why Laurel Hospital Center, which has been closed as an inpatient facility, was reopened this week, creating 135 more beds, including 30 intensive care spaces to care for COVID patients. Those beds relieve stress on Howard County General Hospital and are also available to county residents if needed. So to summarize, we are doing the very best we can to be prepared and are organized and resourced like never before. We are doing everything possible to provide high quality, safe, and compassionate care for our COVID patients and are preparing for whatever additional challenges come our way. If you need Howard County General Hospital, know that we are working with the county, creating the necessary capacity, and benefiting from strong partnerships and constant communication as part of the best healthcare system in the world, so we can provide the services this community needs and deserves.